Well, the mild procedure is a relatively new procedure, and the word mild is an acronym. It means minimally invasive lumbar decompression. So it's a procedure for patients who have a condition called spinal stenosis. So spinal stenosis is a odd term. A lot of people have heard it, but maybe don't know what it is. But it's a narrowing of the spinal canal, and it's a narrowing that happens from what we call chronic degenerative changes. In other words, over decades. This happens over a long time. The canal itself starts to slowly collapse, and you may be fine one week, and then the next week, all of a sudden, you feel back pain and pain down the leg. What happens is one of the connective tissues that normally is just supposed to protect us starts to collapse a little bit and starts to press on the nerves in the spinal canal. So in the mild procedure is a minimally invasive procedure that may help patients stay out of open back surgery, an open laminectomy, let's say. So typically what would have happened is you'd undergo back surgery, you'd have an open procedure, they would have to carve out all of that tissue that's putting pressure on the nerves. But when you really look at the MRIs, in a lot of patients, not everybody, but you have to go very specifically to patients who have a collapse of the ligament that's in back of the spinal canal. They give it a name, it's called a ligamentum flavum. There's no tests afterwards, so you don't have to remember it. But that ligament, it normally holds up the back of the vertebrae in us. And when we're 20, 30 years old, it's straight, it's stiff, it's not pressing on anything. It allows the canal to stay open nicely. But as we get older, it could start to collapse. And it's just that ligament in many patients that's putting pressure on the spinal nerves. So what we do is we found out that we could go in through a small portal that's like a half a centimeter big, and using x-ray guidance, we can debulk that bulked up ligament and get rid of the pressure on the spinal nerves. So the results that have been found in the research, they say, is about 79% get good relief of their pain. And I would say my results are about the same. That's pretty good for a pain clinic procedure, to be giving patients that high of a percentage of relief. I always tell patients it's probably never going to be 100%. The way it could be 100% is if we can actually look in the spinal canal and clear it all out with just the naked eye. But that's not the nature of minimally invasive procedures. You're trying to save people from going through a open back procedure. There's a lot of patients who are too old, too sick to have open back procedures, to go under general anesthesia. We can avoid all that. I've done this on people in their 90s, and they sail through very nicely.